Hello, everyone, and welcome back to another episode of Recharging the Human Battery. I'm your host, Dr. Stefano Sinicropi. I'm joined by Mandi, Dickey, my co-host. Glad to have her back. We missed her last week. We are on AM 950 radio. It's not the nicest day outside today, but it's always a good day when we're upright, breathing, can walk on, our own 2 feet, or just can get up and have another day of this beautiful life. So what we wanted to, kind of talk about today is, I know it's political season right now, but that's not really our interest. Our interest is what's going on in healthcare. And unfortunately, there's a lot of politics in healthcare, and not in the traditional sense of politics. We're not talking about, Democrat, Republican, independents. We're just talking about there are a lot of factions that form in the healthcare industry amongst different types of providers, amongst people that are more holistic and more invasive types. I mean, there's all these different things we can go into. We've talked about it before, but the one thing that I think everyone is starting to come into consensus on, and it's really good to see so much more being shown in the mainstream media, is that our chronic disease crisis, it's preposterous. It's absolutely ludicrous. And, there are many physicians that were not in the camp. They just kind of were sort of doing their thing. And there's so many new books out. There's so many people going on, some of the best podcasts in the country just talking about how bad things are. And my frustration, we're going to get into all this in the show today, but my big frustration, is what I asked Mandi about, is it's the mentality of the general population. Even though a lot of us that have had our own epiphanies and are becoming more enlightened about how bad the situation is, the truth is, in a more global scale, people don't understand how bad it's affecting our population. But even more frustrating, because both of us talk to patients every day, they don't understand how it's affecting them and how their lifestyle choices, and some things that sometimes I tell them things, it's the most simple things, and they're shocked.
Yeah.
What do you think? Am I off base here on anything I said?
Yeah, no, I think people don't realize how much power they have over their own health. We've said it time and time again, the CEO of your own health, but people don't realize how much control they really have. And even as we both sit down and have conversations with patients, you get those aha moments because they realize, oh, I can do that. And that's something that I can do. You don't have to do it for me.
Yeah, absolutely. And I know, we're both friends with Margaret, who we always give credit to. And, she kind of coined the phrase, you need to become the CEO of your own healthcare. And I use it ad nauseum. And she's okay with it. She actually, she'd love it, to spread around. And I'm just proud to, be helping her to spread the FAM movement, which is the Preventative Health Awareness Month movement here in the United States. And we're really going to be trying to push for that. But again, you're absolutely right. What you're saying, people have such an incredible ability to make an impact in their own health. We'll go into this a little further, but just one little tiny, snippet, and not to give away the rest of the show. But it was a great post yesterday, which was based on Casey Means, this doctor that's been out here. She just did an interview with Tucker Carlson, and one little part of the interview was on polycystic ovarian disease. And even I see that, because people say, "Oh, I'm on treating for this and treat for that." The amount of medication for pain management and the amount of procedures that's done for that particular thing is very high. And people think they're doing the best for the patient. But lo and behold, she talks about the fact that if you change your diet and you go on a keto diet for 12 weeks, it goes away. These are the types of things we're going to talk about on the other side of the break. There are so many lifestyle and wellness choices that you guys can make to make a huge impact on your own life, on your family's life. What in the world is going on? My frustration grows daily. We'll talk about it on the other side of the break. Chronic disease, poor sleep, post-surgical recovery, aging, brain health, low energy, post-COVID syndrome, addiction, recovery from injury, cognitive decline. As a long-time practicing surgeon, I wanted to design a clinic that could address all of these issues without medications or surgery. This is Dr. Stefano Sinicropi here, host of Recharging the Human Battery Show and founder of Hypercharge Clinics. And I know it seems too good to be true, but believe me, it's not. Hypercharge Clinic specializes in optimizing health and longevity, combating the symptoms of chronic disease by treating the cause at the source, the cellular level of the body, by targeting the core of our cells, the mitochondria, with non-invasive therapies like Class 4 laser, red light, and many others. We are introducing a new era of medicine that promotes faster healing, pain relief, wellness, and human performance like never before. Experiencing is believing, so call us and schedule your online free introductory session today. Visit hyperchargeclinics.com now. Hypercharge is hope. All right, folks, we're back on Recharging the Human Battery Radio. I'm Dr. Sinicropi, Mandi, Dickey with me. Today, our esteemed nurse practitioner. We are an AM 950 radio, and we're both just so frustrated, and we want to help you guys become the CEOs of your own healthcare. And it just seems simple, like to us, because we this is what we study, this is what we think about, this is what we read about, this is what we argue with our family members about and our friends and our patients, and this is what we think about. But we want you to really, really listen to some of the things we say, and I'll be the first person to apologize. I'm a big repeater. I just kind of repeat the same stuff over and over again. It's just like when you're memorizing a name, right? If you really like, what are the things? That's not really a mnemonic, but what you do is if I'm meeting Mandi for the first time, I keep repeating it. I was like, nice to meet you, Mandi. It's good to see you, Mandi. So if you say it at least 3 times, the more you say it, the more you're likely to remember it. And that's why some of these ideas that we're trying to develop here on this show, and we hope you tune in every single week and just listen, and there'll just be different variations. And there's so many things we're going to cover, over the next several years. But this idea that you can really take matters into your own hands is the kind of unifying factor where no matter, where you're from, what your ethnic background is, what your religious background is, what your political persuasion, it doesn't matter. It's relevant to you, right? If something's good for you, it's good for you no matter what your beliefs are. And if something's bad for you, it's just bad for you. And we want to try to sift through the noise for you, because I can tell you 80%, this is an opinion. This isn't, we're not quoting, 80% of what's out there on social media, even from people that have titles after their name, it is not entirely true. And so we really have to sift things. We have to have a real open mind and take a balanced approach to looking at these things, because as you know, some things which become they become dogma, they become doctrine, even for ourselves. We change our minds. There's things that I believed 5 years ago that I no longer believe now, right? Because when the studies change, when the facts change, we have to change. We can't practice. We can't give you the same advice that we would have in 2020, or right pre-pandemic, or in the year 2000 that we can today, based on the studies that that are out. Would you agree that most stuff that's out there, it's a spectrum, right? It goes from 0% true. Nothing's 100% true. Nothing. That's just not there's nothing's absolute, but it's always on that spectrum, somewhere in between. But I'm going to lean that most things that even I read as a physician, on first glance, I might say, oh my God, that's revolutionary. And then I read, let's say, the fine print, i.e. I actually read the article, because, right, if you just read the conclusion or the summary, you're not getting, you have to read it and say, oh, well, they had 6 patients in the study, not 6,000. That's a very, would you agree that most stuff is more on the conjecture, opinion, and just whatever I feel like saying today?
Yeah. I educate my kids on that all the time, because they'll see things on social media and they're like, well, I learned this. And there used to be the commercial on TV from one of the car insurance companies is, where did you hear that? On the internet. Well, do you believe everything you read on the internet? Yeah. And you can't. It's been around forever. You can't believe everything that you hear on the internet or read on the internet, because a lot of it is opinion and a lot of it is this is my experience, nothing else. But even in research, you have to be careful and read the research and see, what does the data show? Can you actually extrapolate that out?
No, absolutely, and I'm going to extend that even out. Let's just say mass media in general, right? The news, the whatever, no matter what. It could be your favorite anchor on whatever channel you watch. Do you know how many things they say because they're reading it somewhere, right? Do you know how many times on any news channel? This doesn't matter what the political persuasion. Unfortunately, things are so politicized, which they should. In health, there's really no role for politicization. It's really. It's a pet peeve of mine. But that being said, people will come out and they'll say, "Hey, this study showed that if you fast, if people do intermittent fasting," and I'm not going to get into that particular study because I want to bring you data on that. But there was a recent study that came out that basically said if you're in intermittent fasting, you have a higher chance of having heart disease. People were so upset, and I mean brilliant people, were so angry. And of course, some people that were, talking about some of this stuff, then they have to go back and say, "Oh, well, it's more. They didn't, this population, it wasn't a good sample size. It wasn't this, it wasn't that." So people retract studies all the time. And so for those of you that are listening, you have to understand, even the biggest institutions in the world, okay, in my field of spine surgery, I can tell you that people that were absolutely at the height, where whatever they said was absolute dogma, journals, right, such as New England Journal of Medicine and other really big ones, without going into the specifics, have had to retract the articles because they were just pure doctored. They were either doctored, false. There was all kinds of stuff. People were paid to do stuff. So again, this happens in every single industry. Okay, I'm not even picking on medicine. This happens in banking. This happens everywhere. But obviously, our show is more about your health and your well-being. So I even tell you about the things I tell you because I try to be as absolutely non-biased as possible. Mandi is one of the most non-biased people I know. But even we get it wrong, right? Because we read a study and we're very excited. Say, "Oh, if you eat strawberries every day at 6 a.m., it's gonna cure your sleep disorder." We get excited because they say, "Well, we looked at 1,000 patients and it showed this thing," and then we come out and we start talking about this stuff, and then we read some other studies, we listen to people, and we change our minds pretty quickly. So, like I tell you, even on my posts or you're listening to me here, even when we're giving statistics and we're talking, because I'm going to get into some not a huge amount of statistics, but I just want to talk about the different like major chronic illnesses that are out of control. Even when I talk to you about that, you need to do your own research because there is so much out there and you need to make an opinion for yourself and see if that's the right thing for. I mean, how many times have honestly, like I change my mind all the time. Now, there's certain things that are more set in stone. Like, for example, I'm a huge proponent of intermittent fasting, but I also do like vegan diets for people that have cardiovascular disease because there's ample evidence to show it's highly anti-inflammatory and it's good. So that kind of cohort, I think, maybe is not the best for intermittent fasting, all meat diet. That's not what I would be recommending. And I think veganism is good, but I think for more healthy people that really have really good biomarkers for their cardiovascular health, I think, even combining paleo diet with intermittent fasting, it's amazing for your blood sugar levels and all these other things. Again, so there's certain things that I've studied for years. And so, yeah, I can change around the margins, but there's other newer things that are coming out. How many times, right? Don't you change your mind on things? Even, right, like let's talk brain injury. How many times have we talked? I'm sure you've changed your mind on treatments for brain injury quite a bit.
Gosh, I thought I knew what brain injury treatment was before I had my own. And then now that I know all the different options out there, it's kind of a smorgasbord and it's kind of cool knowing that there are so many things that we can do.
No, it's absolutely, and I change my mind all the time, and it's interesting because there's patients I haven't seen for a couple years, and they might say, and again, I try to provide the best information that I have available to date, as long as I am very comfortable that I have studied the subject enough and have looked at enough that I can at least. as a physician, especially for my patients, I have to give them the best thing. So when I don't know, I'm the first person. I was like, you can look at this, go do your own research. I'm not sure, but it looks like it's promising, but I don't want to tell you anything. Maybe find somebody that's more expert than I am to talk about it, because I haven't spent my life researching that, right? But for other things, right, we have to be really careful with. So we try to definitely use hardcore science to make our recommendations, but then there's other things that if it's not doing harm, then I might say, yeah, patients ask me, hey, should I try this herb or whatever, as long as they're not on a blood thinner where they're going to have a brain bleed because they're on it or whatever. So I'll just sit there with the patient. I just pull out my phone and I just look. I say, are there and there's a lot of good, places to look at these things. So when things are safe, if somebody wants to say, hey, I want to do more. I want to drink more water. Well, it's great, right? You don't want to, I mean, obviously that can be dangerous if you overdo it. You can actually waterboard yourself. But in general, it's really hard to do. So that being said, so I do want to talk about it. It's fun. It just came to mind. One of the posts that I did recently on social media, which went, people, I mean, it really, really was popular, and I was just thinking about it. And it's like, even though I try to stay apolitical when it comes to like what people would think of as politics, what I'm not afraid to do is really just call out stuff that I see that I think is like dangerous. And so one of the things I called out, we always talk about imposter syndrome. And imposter syndrome, for those of you that don't know, most of you are probably familiar with it, but basically imposter syndrome means that even like, let's say you earn a big degree. For example, I'll give you an example. Like, I'm an MD. If I become an MD and I start practicing, I'm questioning my own skills because I feel like I'm an imposter in my own skin. And I'm like, I can't believe I'm doing this. I'm not really qualified, even though I am, right? You might be qualified, but you're always questioning yourself. Now, the danger there, and it's not much of a day, is that you're more wishy-washy or you're unsure of yourself. But truthfully, most people that have imposter syndrome, they do more research. They're more unsure. They ask their colleagues more. They're always asking for help, right? Sometimes they come across wishy-washy and people don't like that, but it's safer than whatever. Now, the reverse of that, okay, is something that and I don't know if this is an officially coined name or not, but I did a post and there was massive amount of engagement, massive. If you get a chance, go back, my post and look. I talked about reverse imposter syndrome. And right now we have an epidemic, before we get into the other epidemics, of reverse imposter syndrome. And what that means is that you oversell yourself and your skills to yourself. And so people that have a much higher degree of confidence in their own opinions, in their own skill set, in their own, and the types, they're the know-it-alls. They know everything. You can't criticize them. They're very defensive, right? They do not seek help from colleagues. They do not seek help from mentors because they know everything. And when you know everything, you don't need help. Now, if we on this show were people, and we certainly don't suffer from that, right? We question, actually, everything we say, we question ourselves, right? But reverse imposter syndrome people, like they'll tell you, this is what you have to do. You got to do this, and that. And if you go against them, it's like it's the end of the world. And there's so much of that right now on mass media, on social media, when it comes to health. People come in, they make these sweeping generalizations, right? We saw it during the pandemic. We're not going to go there because people, it's still somewhat politicized, even though it shouldn't be. But we see it in anything where there's people are afraid of stuff, mad cow disease and blah, blah. I can go on. There's all these things. And then people come out and they're just so 100% sure that what they're saying is true. And it's not. We have to continue questioning ourselves. Would you agree that, like, reverse imposter syndrome, it's brutal?
Yeah.
And it's a problem.
Yep.
And it's like, it's part of the problem of what we're dealing with right now. And these are the people that are supposed to be helping you to stay healthy, right?
Yeah.
So.
Yeah, there were so many things I wanted to say on that post when you did that, that I've worked with so many people that have that. And it's dangerous to the patients because they say, well, this is what you should be doing, but they don't think of other things that could be out there.
No, absolutely. And we have to continually be questioning ourselves, going back to the data. And that's why, like, we both have podcasts Mandy and I, we interview people from all over the world, and the whole thing about it is the reason is because I want to know from them, and I always ask them because I sometimes come with preconceived notions, and by the end of the podcast, I've completely changed because I'm like, maybe I should listen to this person because they're literally the foremost expert in the world. They know just slightly more than I do. I don't start arguing with people that are the foremost experts in the world about something that they've been studying since they're 16 years old, and now they're 80. And I'm telling, no, you don't really understand. I know. I'm a spine surgeon. Let me tell you how it is. Right? I try to take that information and then distill it down and help you to make decisions, but I'm also helping myself to make decisions in that thing. Let's get to just okay. So what is this catastrophe? You hear us on the show. We're both like very positive, like glass half full people, but yet it's hard to be glass half full when we are seeing people constantly, whether it be in our medical practices or in our wellness practices, they're literally disasters. You know them. It might even be you, but if you look around. Your family members, how many of your family members are sick with multiple chronic diseases, right? We've gone through this before. It's a high percentage of the population now that has one and almost half that has two. It's a disaster. So let's talk about what's out of control, right? I'm not just, this is all real. Heart disease, completely out of control, okay? You know what? If you guys want, to have a reason to live better lifestyles, why don't you come down to some of the hospitals we work at, come down to the medical ICU and look at all the patients who have had massive heart events, who are there on ventilators, sick on death's doorstep. Okay? Just see what they do. Let's ask their families what that person's lifestyles were, if they know, but let's ask them. And then we can think about, is this the path we want to go down? Diabetes. Okay? Absolutely out of control. The prevalence of diabetes since 1980 quadrupled. It's quadrupled. How is this? Why is this not alarming? Okay, now when this, again, we try not to be political at all on this show, right? Because we want to hear everyone's sides. We want to, medicine has to be completely inclusive. There's no role for, but however, I'm going to make a little statement. Okay, I always, my personal concern with the political parties, okay, the two major political parties, is what is going on in healthcare, because we need to make radical changes. Okay, as far as I'm aware of, I didn't watch every moment. I mean, I look at both conventions or at least read about them. Zero. I didn't see. Where were the why were they not parading doctors around saying, hey, we have to make these dramatic, radical changes, right? We're going to do this. We're going to provide another, this credit and that credit. Well, what's good is they're getting sicker. The credits it's not working. We have to change the very fabric of what we're doing. Let's say this again, quadrupled since 1980. How is that? Why is this not spoken about more? Cancer. It's going in one direction. It's higher. What's going on? What has changed, right? With cancer, I'll tell you what has changed. Our lifestyles, right? We're going to get into that in a minute. Respiratory disease, COPD, asthma. The rates of smoking have actually, that's one thing that has come down. Mm-hmm. Why? Because, right, you can't do commercials anymore. You can't do stuff. Now, some people, you guys that are listening to us in Minnesota, you're like, it's come down? Really? No, because so many people smoke it. But that being said, these conditions are increasing. And if you look since 1990, it's increased by 45%, 50%. These are dramatic numbers. Mental health disorders, I'll tell you, I'm not even going to quote numbers on mental health disorders because it's useless to quote numbers when most of the, not most, but a lot of people that have mental health disorders, they don't want to talk about it because of the stigma, they don't whatever. But let's dig deep down inside. Think about the people you're around. How many people that we are around, like Mandy, how many people that you are around personally, like even in the hospital setting or in the clinic setting, like let's be honest, and you walk away, you're like, that person's really struggling. It's more likely than not that the next person you talk to is struggling with a mental health disorder. Would you? I mean, it's crystal clear to me.
100%. I would say nearly everybody has something at this point, basically, after conversations with patients, with family members, with anybody. Everybody's struggling with something. It's just whether or not they're willing to admit to it and whether or not they want to ask for care, because there is still that stigma.
Right. Yeah, we're all struggling. You guys know we always talk. I always talk about physician burnout and all these other things. There's anxiety and depression. Our kids, we went through the pandemic. Again, this show, we're not going to get into all that stuff because that is a show in and of itself, the mental health disorders. We've talked about it a little bit before. We'll talk about it again. But all of these conditions, you can throw on other stuff, hypertension, dementia, autoimmune disorders, all going in the wrong direction. And I'm going to, again, repeat. We're over $4 trillion to spend. Per capita, we spend more than anyone else in the world. It is getting absolutely worse, and it gets worse year after year. We're not getting better at it. We need dramatic changes. Just throwing more money at yes, we need to throw money at it, but just throwing more money at more drugs and more other stuff, it's not going to do it. It's just not going to work. We need to throw money at educating people on preventative care lifestyles, right? I mean, is there, right? Throwing more money, I get it. There are many diseases where we have to throw a lot more money, genetic disorders and all these other things. Do we really need 20,000 more diabetic, pills? How about we just reverse diabetes through natural means and meds when it's severe, and then we don't have to worry about diabetic medications?
Yeah. I remember when I went through nursing school, I was taught that lifestyle changes made a bigger difference than pharmaceuticals, but that's not what you see in practice. Pharmaceuticals tend to be the first line of choice, and lifestyle makes so much of a difference.
I've had every whether or not people are holistic or whatever, and I've mentioned this before, I've had people neurosurgeons and and psychiatrists, all these people, no, they're just traditionally trained docs that have traditional practices that have come on my podcast, and I asked them about this very thing. There's no one that's like, no, lifestyle's better than medications. End of story, right? Not to mention all the downsides. Again, the purpose of this thing, we are not giving medical advice, we're not doing stuff, and we are certainly not, we're both deeply involved in Western medical care, and some of the drugs are absolutely 100% life-saving. There's no question about it, but they're wildly overused, and they are used in situations where there are way other options. And again, without getting now we're going to get a little bit. So I want to talk about Mandi's experience with her own family. So why don't you tell us, kind of like just tell us a little blurb on your dad and kind of what he went through and mentality and things like that.
Yeah, this was a really interesting experience, actually. So back in 2017, my dad had a what he says is a minor heart attack. Now he's platinum because he's got platinum in his heart. But he had a diabetic education class because he's a type 2 diabetic. I went to the class with him, and I sat in the class, listened to all the education that they gave, which is based on the American Diabetic Association. That's all that we are legally allowed to tell patients, is that follow the ADA guidelines. We walked away from that meeting, and I looked at my dad, and I said, Dad, you cannot follow those guidelines. The number of carbs that they were telling me to eat every meal, that should be your max. That should not be the minimum of what you eat, because if you're constantly eating that, you're constantly going to need to be on medications. So I went home with them, and I taught them a couple different meals, and my dad was impressed to see that he could have a lettuce wrap sandwich, and he could have multiple. Like that, yeah, you're not eating all that bread. You can absolutely eat more. And it was just those little things that would have made such a big difference for him. And he had no idea that he had any of that control. He thought, well, it's just, I'll do what they tell me to do. But you do have to question what you're being told, because that information, again, if we all follow it, and I've learned this along the way too, if we all follow the standard American diet, it stands for SAD. We all become SAD because we will all end up with diabetes type 2 at some point if we follow that standard American diet.
Yes, that is absolutely correct. Now, it's interesting. So as far as the bread, I love the fact that you throw the bread out. So I'm just going to say that I don't know how else to say this. So sugar, okay, especially highly refined sugar, Okay, now I'm not talking about things you find in an orange. I mean highly refined sugar. So if you look at white bread, okay, and you need to look at white bread and how many sugar cubes it equates to. Now every brand is different, but it's just pure sugar. It's not. You just don't think of it that way. You think of a Twix bar as a lot of sugar or whatever, or candy.
Yeah.
But bread is just as bad because guess what it's converted to? It's converted to sugar, and it's junk. So I'm going to say this. Again, ultra-high processed food. Let's start at the basic, ultra-high processed food and sugars, okay? All these toxins, it's the devil. It's the devil in disguise. Don't let the wrappers fool you. Don't let the BS that's on side of the label. Don't let things like heart healthy or 5 grams of protein added. Well, that 5 grams of protein, maybe it'll help you to live an extra 10 seconds in the ICU because you're in a diabetic coma, which you're going to end up in if you follow some of these different diet, like some of these American diets that we see. The bottom line is those things are really are the devil in disguise, and we just have to call it out. That stuff is ridiculous. Okay, I think that what we need to do is really start, like on one of these shows, we just have to bring in like all these different labels from Big Food and just start showing it and just start reading all these different labels. This heart healthy and good for you, and it's got reduced sugar. Well, good. Let's not even get. But it's interesting because what you said about the ADA. So without getting into, folks, you know what I'd like you to do? Do some research on who's the major sponsors behind the ADA. We'll talk about it in a later show. It's very interesting. But speaking about the American Diabetic Association, so there's a guy, he's one of my favorite guys. His name is Dr. Robert Lufkin. I had him on my podcast. He wrote a book. It's a bestseller right now. It's called Lies I Told in Med School. And he's become super, super popular. He's on this big book tour right now. But one of the funniest posts, so he does a lot of satire on his posts, and he actually posts a lot every day because this stuff really bothers him. And he did a post, and he actually showed the video from the one of the representatives of the ADA, who just kind of showed the portions and how many carbs you should have and things like that. And he's like, I'm showing you this video. So they're like, basically, if you want to get diabetes, follow her advice. I mean, listen, this is our frustration. It is like for us, what we think about this stuff, because obviously this is what we think about the most. It's so blatantly obvious. They are lying. I mean, they literally are lying to you. I'm not talking about I'm saying as a they being the powers that be out there are absolutely lying to you to profit off of you. We're just all commodities. It's disgusting. It's absolutely disgusting. And I'm a lot more comfortable talking about this physician. A lot of physicians are just not comfortable talking about this, the pushback or this and that. Ultimately, we went to med school. You went to nursing and then nurse practitioner school to help people. The best way that I can help you is to open your eyes to how bad it is, and we'll do a show dedicated to really going through all of the statistics of all these different disorders that are completely out of control. And I urge you to watch the interview. And again, it's not political. We cannot make this political, but this Dr. Casey Means, she went on Tucker Carlson's show. I don't care what your political bent is. If that's not, if you don't like Tucker or whatever, it doesn't matter. Listen to the doctor and what she's saying. She wrote this book, Good Energy. Listen to the statistics. It's so much worse. It's hard to, and we need an entire show to talk about how bad it is. Now, we're going to say the same stuff. Some of these drugs and the commercials and all the stuff that are being pushed, can the drugs have some effect on these conditions? Absolutely. But what if your lifestyle changes can reverse that in and of itself? Let's just give one specific example that I love. I gave you the example of the polycystic ovarian syndrome. Here's another example. This is even bigger, diabetes, right? Over 80% of diabetics will reverse their type 2 diabetes by going on an intermittent fasting diet. You don't have to believe me. Go to the experts. I go to the experts. I haven't sat in a lab, researching this stuff. Dr. Jason Fung, the Obesity Code, which I do give I do suggest to my patients to, to buy that book because it's great to learn about intermittent fasting and, what mostly what the benefits are. It's not for everyone, but most people can do it safely. But think about that. If we can reverse, let's say 80% of if it was 50% of diabetes, right? Let's say there is some bias there. Reverse to 0. Well, you're not diabetic. You're on no meds. You're neither on the orals nor the injectables. That stuff that you're taking, yes, it can be life-saving, okay? The GLP-1s, they can be life-saving in certain things. I'm not anti-GLP-1, right? The semi-glutides, which have been great for weight loss and diabetics and stuff. But lifestyle can reverse a lot of these things without the risks of the medication. Why this is this is where we need to be pouring our dollars into to educate people, right? So if the government and these bodies are not going to be pouring their dollars in, that's why we've taken upon ourselves, and many providers are taking upon themselves now to try to educate you on this stuff. So what are the lifestyle factors that are just literally killing you? I'm not saying that this isn't hyperbole. It's literally killing you, right? We're sedentary. We sit all day. We're in front of screens. We're obsessed with mass media and social media. We're taking in toxins constantly. Anything that has a wrapper on it, please read the wrapper. Most of that stuff ain't good. We're seed oils, all kinds of stuff that I don't even know what the things are. Why? Because no one's even vetted it. There's all these different additives in there. Some of the stuff is banned, but you know what? In the good old USA, we have less stuff banned than in most Western countries. Okay, that's a whole other entire episode. We've got, potentially environmental toxins, right? We've got smog in the air. We have microplastics. We are breathing all kinds of things. We are exposed to radiation because we're always on our devices, right? So we have got 5G towers, 4G towers, our cell phones. There's all these different radiation, all these different blockers, that we're exposed to. We don't exercise. We don't even walk. You were sharing a story about how you can't even get your patients to walk.
Yeah.
They don't even go get the mail, right? Because their antenna, it's catastrophic. So they just sit there, getting sicker and sicker and sicker, right? 7 hours a day on our screens. We just sit there and we're obsessed and we're doing all these things. So the lifestyle factors. So again, let's think about what can we do. We've already brought, and I don't want to leave out the big one, sugar and the toxins in our foods, but what can we do, to reverse it? Our time's getting a little short, so we'll just blur up dietary changes. Mm-hmm. Critical. If you guys take nothing else from this, please go on. All you have to do is type in scientifically vetted dietary plan that can help me in my life. Just type that in. It's not going to say that you need to increase the amount of carbs in your diet. I guarantee it's not going to say, hey, you should have more white bread. Hey, you know what? We should have more ultra processed foods. And that's not going to come up. Okay. And no matter who's paying for that stuff's not going to come up. So that's a big one. Exercise and physical activity. If you can't get to the gym, if you don't want to do a program, at least walk. Start by walking. Start by being active. Start by taking the stairs instead of taking the elevator, this and that. Get the other toxin that I didn't bring up before is like the mental toxin of stress. Stress is a horrible thing for us. So meditation, breath work, those kinds of things are hugely, hugely important strategies. If you're spiritual, like really get in touch with your spirituality, take breaks, learn how to say no. We really, all the things I'm talking about, if you really want to make a difference, go on this something called the internet. It's been around for a while. I don't mean to be sorry, but again, use the internet not to see what your favorite movie star is saying about some random thing that's not going to help you in your life, but use the internet to really look up what are strategies. Just put in there strategies I can use to improve my lifestyle to get rid of my chronic disease, and you can read for days. You think these? I think I covered. I mean, those are the. I mean, we're at these are the basic, but we're not even getting into the biohacking. We talk about whatever.
One more that you really got to have in there: sleep.
Oh yeah,
because you can do all the things right with your diet and exercise, but if you're not sleeping, you're erasing everything you just did.
Yeah, absolutely. Sleep is big, and we promised to do a show on sleep, but we really want to really bring you a lot of the latest and greatest data on sleep habits and things like that. It's absolutely, and the sleep goes into this. So again, we don't have the time to get into sleep today, but the couple things. One, a lot of your metabolic processes happen while you're sleeping. So you so to speak, you take out the trash, your gut gets to rest. It helps your microbiome. That's a whole thing in the nutrition category we don't have time for. But when you don't sleep, all the other things I just mentioned really go out the window. Then you don't get to the gym. You don't want to take that walk. You certainly are going to reach for those Doritos, right? Instead of right when you're dead tired, right? Those blueberries or that salad just doesn't. That's not appealing. You want something, right? You just want sugar, right? To do it, and it's horrible. So everything suffers, and obviously you're not the most pleasant person, right? We're irritable. Not you. I'm not talking to Mandy. I'm looking at her, but I don't mean her. I mean the world in general. So yes, sleep is another thing. So a lot of the things we're going to talk about, we do want to dedicate specific episodes to going through all these things as we really start available for you guys. So you can just click on whichever episode and say we're going to do the sleep episode or the dietary changes or we're going to do the meditation episode, because we do have to do one episode really on getting more I'm telling you, it will make the biggest impact on your life if you can change your behaviors. Dr. Stefano Sinicropi here, host of Recharging the Human Battery radio show. If you've been listening to me, you know how passionate I am about health and vitality. As founder of the Hypercharge Clinics, I'm dedicated to restoring your human battery to reboot your vitality, health, and performance. We focus on proactive wellness care, optimizing health and longevity by treating chronic conditions, chronic fatigue at the cellular level, all without medication or surgery. Do you suffer from chronic pain, disease, or just have low energy levels? Do you have more serious conditions? Well, Hypercharge Clinic is for you. We use non-invasive, non-operative modalities to improve your energy, slow aging, boost brain health, and help you to rapidly recover from injury and just to be your very best. Experience the future of wellness today. Call or schedule online for your free introductory session. Hypercharge is hope. Visit hyperchargeclinics.com now.
Welcome back to Recharging the Human Battery on AM 950 Radio. I had to steal the mic from Dr. Sinicropi because he's gotten a little fired up on all these topics. We have so much that we've covered today, and just kind of wrapping up in these last few minutes here. Again, you have so much power as the person that has these diagnoses, as the individual himself. You can have so much say over your own diagnosis. Do some research. Do educate yourself. Think about some of the topics that we brought up today. Like I said, we'll have episodes on all of these topics, and we have a lot to cover.
Thanks. I was having a tough time there. I was looking at my notes and I'm really fired up today because I am frustrated about what's going on. We really have to get people baby steps, right? Absolute baby steps here. We need to, just like your patient that can't just walk out to the front porch. We've got to start slow. So just little advice. Try to get your sleep hygiene better, right? So put down that phone, go to sleep, and try to stay away from blue light, even get blue light blockers. Listen to relaxing music or get apps like Newcom and other apps that are available to help you sleep. There's a ton. You can do all this research on this stuff. It has made a big impact on me because sometimes I can't get the required amount of sleep, but if I can get deep, restful sleep by using some of these biohacking techniques, it's really incredible. Start slow by changing your diet. The reason I'm such a big fan of the intermittent fasting, so much easier to tell people, hey, if you restrict your eating window to 8 hours a day, maybe start at 10. Maybe start at 10 hours a day. Maybe 12, right? Maybe just don't have those late night snacks. You've got to start somewhere. Another big one. Listen, meditating or doing breath work or taking time where you're really calm or doing mantras or doing gratitude practices, not even the studies show that literally, if you can just calm your brain for 1 minute, 60 seconds, try to sit there and take 60 seconds of a deep breath. Feel the breath coming into your nose and then out of your nose. You could breathe into your mouth, out of your nose, whatever. Bottom line is, you try to do that and kind of empty your mind of thought. You just start slow. You don't have to meditate like a yogi the first day. You can meditate for 1 minute, 5 minutes. I mean, I recommend 5 minutes is a good thing. Believe me, your mind races wildly. You know, when I get off of meditating and then I go back, I mean, I can't, 2 minutes and I'm thinking about whatever. Oh my God, there's a hurricane going to hit Florida. Okay, I don't know why it's popping in there, but it's popping in there. But I think just taking these really baby steps, try decreasing your sugar. Try looking at your sugar intake. Try fresh, whole foods, right? Even if you can't intermittent fast. If everything you eat doesn't have a label on it, you are going to become healthier. Period. I could say that. That's ex cathedra. That's from the pulpit. You know, that's something that you would hear at your, at your church if you're a believer or whatever. But there are these little habits that we can do that can dramatically improve our lives. And guess what? It's like anything when we procrastinate. Sometimes you just have to start, right? Sometimes I have to write whatever. I have to write a post, or I have to do something, or I have to do something for work, or an uncomfortable email that I have to write. Before I start, I feel it's like the end of the world, right? Once you start, you just feel like you can do it all day. You just have to start, and it'll snowball. You'll get healthier and healthier.
But it's not magic. It's not going to happen overnight. So trying it once and saying it's not for you is not going to be the right thing either. It takes, 3 weeks, at least 21 days to build a habit. And think about these bad habits that you've had. You have to have time to unlearn those so that you can learn the healthier habits. So it's not going to be an overnight fix. You got to give it time.
And on that note, hopefully by listening and tuning into our show, Recharging the Human Battery on AM 950 Radio, you pick up a little something from each one of our episodes to try to lead better lives. Again, be the CEOs of your own healthcare. I'm a little depressed that this episode is ending today because I feel like I'm just getting started. So we'll see who's the target of my next rant. I'm sure I'll find somebody to listen to me. And we will see you next week on Recharging the Human Battery. It's been a pleasure. Take care of your families. Take care of yourself. Start small, but just start.